Hi friends, once again welcome back to the Nurse channel. So the most awaited AIIMS NORCET examination date has been declared, and the details of the examination, the number of vacancies, and how to apply examination fees, all details regarding the examination is available in our web page. You can go through that. So keeping the AIIMS NORCET examination in mind, we have started a series called the AIIMS NORCET series, and this is the fourth video which is coming under this series. And this series, as like the other series, you can see 15 very important questions which are taken from different subjects from our nursing topics, and these questions will definitely help you to prepare well for the upcoming examinations. So the peculiarity of these videos are like we are including picture based questions, picture based explanations, and detailed explanation for each question, and for each options we have given such a good explanation. So whoever watching this video, I request you to kindly watch the video till the end without skipping, because explanations are very important. So straight away, without losing time, we will move on to the videos. Before that, whoever not yet subscribed our channel, kindly subscribe our channel and enable the bell button so that you will get the notification whenever we are uploading new videos. So straight away, moving on to the question. This is the fourth series of AIIMS NORCET series. So we will start this session with a very simple question. So the first screen for you in the screen right now. So the question is, which disease is also known as gluten sensitive enteropathy? So question is, which disease is also known as gluten sensitive enteropathy? So the options for you are option number A, hemophilia, option number B, celiac disease, option number C, beta thalassemia major, and option number D, hemophilia B. So which one is known as gluten sensitive enteropathy? So the answer is option number B, that is celiac disease. So easily you can identify the answer for this question from the options itself. So we will have a small explanation regarding these disease conditions and their another names. Okay. So celiac disease, it is a long-term autoimmune disorder primarily affecting the small intestine, where individuals develop intolerance to gluten, which is present in the foods such as wheat and barley, and it is also known as the gluten sensitive enteropathy. So the gluten is the problematic chemical what we can see in the celiac disease. So it is known as a gluten sensitive enteropathy. Enteropathy, that means it is related to the small intestine. Okay, so that is celiac disease. Then what about the other disease conditions what I have given in the option? So hemophilia B, you know that it is a blood clotting disorder causing easy bruising and bleeding due to an inherited mutation of the gene for factor 9 and resulting in the deficiency of factor 9. So the clotting factors that you have to study. So it is also known by the eponym Christmas disease. Why? Means it was named after Stephen Christmas, the first patient described with hemophilia B. Okay, so this is a patient described with hemophilia B. Okay, so that is hemophilia, or otherwise known as the Christmas disease. Then what is the hemophilia A? Hemophilia A is a genetic deficiency in clotting factor 8. Okay, so which causes increased bleeding, and usually it affects the males. Okay, so these are also definite genetic disorders. Okay, so what is a beta thalassemia? So beta thalassemias are a group of inherited blood disorders, and they are forms of thalassemia which is caused by reduced or absent synthesis of beta chains of the hemoglobin that result in variable outcomes ranging from severe anemia to clinically asymptomatic individuals. Okay, so the structure of the hemoglobin that you have to learn before studying beta thalassemia, so that you can refer later. Okay, so some chains are there. So here the beta chains of the hemoglobin is getting affected, and the individual can result in severe to subnormal anemia or clinically asymptomatic individuals. That is beta thalassemia. Okay, so that's all regarding the first question. Now we will move on to the second question in the series. So the question is, infant to a pregnant woman treated with lithium may present with which among the following? So the question is regarding the teratogenic effect of lithium. Okay, so the options for you are option number A, neural tube defects, NTD, Then option number B, skull defects. Option number C, cardiac malformations. And option number D, genitourinary malformations. So what is the teratogenic effect of lithium? That's the question. So what is the answer? So lithium, as you know, it is used as a treatment for mania. So if a pregnant woman takes lithium, the child may present with cardiac malformations. Okay, so cardiac malformations is the answer for this question. So we know that the main effects that is attributable to lithium are cardiac manifestations and babies with increased birth weight. Okay, so there has been concern that exposure to lithium early in the pregnancy may be associated with a marked increase in the risk of Epstein's anomaly. Okay, so cardiac malformations, then increased birth weight, and some studies it is quoting like there are increased chances of getting Epstein's anomaly. So these are the teratogenic effects of lithium. Okay, so I think that you got the point. Now we will move on to the third question in the series. So the question is, Velcro-like fine bilateral crackles can be heard in which disease condition? So this is regarding a crackle, that is a abnormal lung sound. So here the crackle characteristics they have given like Velcro-like fine bilateral crackles. So this can be heard in which disease condition? That is a question for you. And the options are option number A, COPD, option number B, heart failure, option number C, pulmonary fibrosis, and option number D, pulmonary edema. So through the process of elimination also you can find the answer for this question if you don't know the answer directly. So because many disease conditions that which are familiar with us are also given in the options. So the answer for this question is option number C, that is pulmonary fibrosis. Okay, so we know that in the bilateral fine crackles on the chest auscultation are detected in 60% of patients with idiopathic pulmonary fibrosis. So the characteristics are these crackles have a distinctive Velcro-like character. Okay, so this is the key point. Velcro-like character and are heard during middle to late inspiration. Okay, so it can be heard during the middle to late inspiration. So now we will see the characteristics of crackles which can be heard and in the other disease conditions what I have given in the option. So the first option was regarding the COPD. So in COPD we can hear coarse crackles which is heard at the beginning of the inspiration. Okay, so that is the point, at the beginning of the inspiration, and are commonly heard in patients with COPD. And along with that, especially those with chronic bronchitis, and along with that we can see these crackles have a popping like character. Okay, popping like character. This is another key term that you have to remember regarding the COPD auscultation findings, and it may vary in number and timing and may be heard over any lung region. Okay, so along with that wheezing also you can will be there. Okay, so coarse crackles at the beginning of the inspiration, popping like character. Okay, see, these are the key terms. So next option what I have given was regarding the heart failure and then the pulmonary edema. Okay, so we know that the reduced breath sounds and or coarse crackles are associated with pulmonary edema and heart failure. Okay, so this wheeze can also be associated with pulmonary edema and it is referred to as cardiac asthma. So cardiac asthma, it is related to the pulmonary edema, and that is the wheeze that can be heard on auscultation. Okay, so the four options and the four disease conditions and the four abnormal breath sounds that can be seen in these disease conditions also explained very briefly through this question. Okay, so now we can move on to the next question in the series. So we have the fourth question in the screen right now. So the question is, the best time for inserting IUD is between which days of menstrual cycle? So intrauterine devices. Okay, so options are option number A, within 2 days, option number B, 3 to 7 days, option number C, 8 to 10 days, and option number D, 11 to 14 days. So which is the best time for inserting IUD? So what is the answer? So the answer for this question is option number B, that is 3 to 7 days. Why? that we will see now. So what time of cycle is best? So before that I will tell you why 3 to 7 days. So you know that it is in the bleeding phase of the menstruation. So during the bleeding phase, the uterine muscles will be relaxed, the opening will be relaxed, so that we can insert the IUDs little more easily. It will be little more painless, and it will be easy to insert. So that is the purpose of putting the IUD in these days. And you should know what is the time, what time of the cycle is best for the IUD removal. So the best time to have IUD removed is the first few days, that is from the day 1 to 3 of period. Okay, so removal is 1 to 3, then insertion is 3 to 7. So with that, key terms that you can remember about this point. Okay, so I think that was a informative question for you. Now we will move on to the next question, that is the 5th question in the series. So question is, Tourette syndrome has popularly been associated with which among the following? Okay, so this question is regarding the Tourette syndrome. So what is associated with the Tourette syndrome among the options what I have given? Okay, so the options for you are option number A, obsession, option number B, catatonia, option number C, coprolalia, and option number D, phobia. So which is associated with Tourette syndrome? So there are so many ticks that I will explain in the explanation session. So what the question is, among these options which is associated with the Tourette syndrome? So the answer for this question is option number C, that is coprolalia. So what is coprolalia and what is the Tourette syndrome, that we will see now. So Tourette syndrome, or the Tourette's, it is abbreviated as a TS. It is a common neurodevelopmental disorder that begins in the childhood or adolescent period. So it is characterized by multiple movement or motor tics and at least one vocal tic. So this is very, very important. So this is the criteria to diagnose a Tourette's disease. So there should be multiple movement or the motor tics, and along with that at least one phonic tic should be there. Okay, so the common tics that can be seen in the Tourette syndrome are blinking, coughing, sneezing, throat clearing, then facial movements, etc. So along with that, in some patients we can see it has been popularly been associated with coprolalia. What is coprolalia? Coprolalia is the utterance of obscene words or socially inappropriate and derogatory remarks. Okay, so this is known as the coprolalia. Okay, so I think you got the point. So we will see the next question. So next question, number 6. Which among the following are named as tocolytics? Tocolytics. So the options for you are option number A, oxytocin, option number B, ergot derivatives, option number C, uterine stimulants, and option number D, uterine relaxants. So which among this is termed as tocolytics? So what is the answer? So the answer for this question is option number D, that is uterine relaxants, tocolytics. So what we will see, tocolytics and uterotonic drugs. Okay, so first of all, tocolytics, otherwise known as the anti-contraction medication or labor suppressants. Okay, so these are the medications which are used to suppress premature labor. Okay, so from the name itself it is clear, tocolytics. So we know that the commonly used tocolytic medications include beta-2 agonist, calcium channel blockers, NSAIDs, and magnesium sulfate. Okay, so these are the common beta-2 common tocolytic agents which are in use. So these can assist in delaying the preterm delivery by suppressing the uterine muscle contractions, and their use is intended to reduce the fetal morbidity and mortality which is associated with the preterm birth. Okay, so that is a tocolytic medication. Lytic, that means that suppression of the uterine contraction. Okay, so I think that is clear. Now we will see what is a uterotonic drug. So uterotonic, also known as the oxytocic or ecbolic, it is a type of medication which is used to induce contraction or greater tonicity of the uterus. So uterotonics are used both to induce the labor and to reduce the postpartum hemorrhage. So these are the two indications. So the common drugs which are in use are oxytocin, misoprostol, ergometrin, etc. Okay, so I think you are getting information regarding two group of drugs, that is a tocolytics and uterotonic or oxytocin drugs. Okay, so I think that is clear for you. Now we will see the next question, that is the 7th question in the series. So the question is, which among the following is a high ceiling diuretic? High ceiling diuretic, that is a key point. So options are option number A, chlorothiazide, option number B, mannitol, option number C, spironolactone, option number D, furosemide. So I have given examples of some group of diuretics. So from this you have to identify which is a high ceiling diuretic. So what is a high ceiling diuretic? That we will see in the explanation. So before that, the answer for this question is option number D, that is the furosemide or the common Lasix. So Lasix, it is a example of loop diuretic, and loop diuretics are also called as a high ceiling diuretic because they may cause a substantial diuresis. That means up to 20% of the filtered load of sodium chloride, that is the salt, and water. So substantial diuresis is possible with loop diuretics, and that is why it is called as a high ceiling diuretic. So this is large in comparison to the normal renal sodium reabsorption, which leaves only about 0.4% of the filtered sodium in the urine. Okay, so this is the reason why loop diuretic is called as a high ceiling diuretic, and examples are furosemide, torsemide, etc. Okay, so I think you got the point, that loop diuretic, otherwise known as the high ceiling diuretic. Then the other diuretics, we will see the action in a very brief way. So thiazide diuretics are the class of drugs that inhibit the reabsorption of 3% to 5% of luminal sodium in the distal convoluted tubule of the nephron. Okay, so this is acting on the distal convoluted tubule of the nephrons, and it inhibits the reabsorption of sodium. Okay, so by doing so, the thiazide diuretics promote natriuresis and diuresis. Okay, so the examples are chlorothiazide, metazone, and so many other examples are there. So that is a thiazide diuretic. Then comes this potassium sparing diuresis. So potassium sparing diuretics are weak diuretics, usually prescribed in combination with other types of diuretics. Okay, so these are used to increase the amount of fluid passed from the body in urine, at the same time preventing too much potassium being lost with it. So potassium sparing, as the name indicates, the potassium will be spared, it will not be urinated out. Okay, so the example is the spironolactone, or we usually called it as a aldactone. Okay, so that is potassium sparing. Then last is the osmotic diuretic, and the common osmotic diuretic in use is the mannitol. So here the principle is osmosis. So an osmotic diuretic is a type of diuretic that inhibits the reabsorption of water and sodium. Okay, so the mannitol, it works primarily by increasing the plasma osmotic pressure, leading to brain dehydration and decrease in the ICP, with consequent improvement in the cerebral perfusion. So to reduce the cerebral edema, to reduce the ICP, we are giving mannitol as a osmotic diuretic. Okay, so with this question you are getting information regarding the 4 types of diuretics and why loop diuretics is known as the high ceiling diuretic. Okay, so I think that is clear for you. Now we can move on to the 8th question. This question is from the biochemistry. So the question is, inactive protein form of an enzyme is called dash. So what is an inactive protein form of an enzyme is called? So the options are apoenzyme, option B coenzyme, option C haloenzyme, and option D cofactor. So slightly confusing but interesting question. So the answer for this question is inactive protein form of enzyme. So the answer for this question is apoenzyme. The option number A, apoenzyme, is the answer for this question. So apoenzyme or the apoprotein, it is an enzymatically inactive protein part of an enzyme which requires a cofactor for its activity. So from this statement itself you will get an information regarding the cofactor also. So apoenzymes, they are enzymatically inactive proteins and it requires a cofactor. So apoenzyme along with the cofactor will create an action for a enzyme. Okay, so then what is a coenzyme? So coenzyme is defined as an organic molecule that binds to the active sites of the certain enzymes to assist in the catalysis of a reaction. So this coenzyme is acting as a catalyst. Okay, and the examples of coenzymes include that nicotinamide adenine dinucleotide, then nicotinamide adenine dinucleotide phosphate, then flavin adenine nucleotide, etc. Okay, all these are the examples of coenzymes. Okay, so another option what I have given was the haloenzyme. So what is a haloenzyme? Haloenzyme is a biochemically active compound which is formed by the combination of an enzyme with a coenzyme. So when an enzyme is combined with a coenzyme, then it will become biochemically active, and that chemical is known as the haloenzyme. Okay, and the examples include DNA polymerase and RNA polymerase, which contain multiple protein subunits. Okay, so that is a haloenzyme. Then what is a cofactor? So cofactor already we have explained. Cofactor is a non-protein molecule that supports a biochemical reaction. So cofactors can take the form of metal ions, organic substances, or other molecules with beneficial characteristics not typically present in an amino acid. Okay, so these are some points that we have to study for our exam, because these are very important terms. Okay, so slightly confusing, but it's very important. Now we will move on to the 9th question in our series. So here I am asking about a sign known as the snowman sign. So what is the snowman sign in cardiology? So the options for you are: option number A, transposition of great arteries; option number B, atrial septal defect; option number C, total anomalous pulmonary venous connection; and option number D, ventricular septal defect. So in which condition we can see a snowman sign in the X-ray? So what is the answer? So the answer for this question is option number C, that is a total anomalous pulmonary venous connection. Okay, so here we can see the picture of a snowman sign, or the figure of 8 sign. So this is a picture of a patient with that anomalous pulmonary venous return. So snowman signs refers to the configuration of the heart and the superior mediastinal borders, which is resembling a snowman. So you can see here. So this is seen in total anomalous pulmonary venous return, and it is also referred to as a figure of 8 sign. So we can see a figure of 8 also here. Okay, snowman sign or figure of 8 sign, which is can be seen in the total anomalous pulmonary venous return. Okay, so I think that is clear for you. Now we can see the 10th question in the series. So a very important question. So Rhizus sardonicus is associated with which among the following? So Rhizus sardonicus is associated with which among the following? So the options are: option number A, polio; option number B, cerebral palsy; option number C, muscular dystrophy; and option number D, tetanus. Rhizus sardonicus. So the answer for this question is option number D, that is tetanus. So we know that this is a picture of a patient with Rhizus sardonicus. Okay, so Rhizus sardonicus is also known as the rictus grin. It is a highly characteristic abnormal sustained spasm of the facial muscles that appears to produce grinning. Okay, so that's why it is otherwise known as the rictus grin. It may be caused by tetanus, then strychnine poisoning, or Wilson's disease, and has been reported after judicial hanging. Okay, so this is the Rhizus sardonicus, sustained spasm of the facial muscles. Okay, I think that is clear. Now we will see the other options what I have given. So in polio, the contraction, this is a typical contractures that can be seen in the polio. Okay, so flexion contractures of hip, knee and equinus. Okay, hip region, knee region and the equinus. Deformity of the ankle are common in polio. Okay, so this is a polio contractures, flexion contractures. Okay, so then the next option what I have given was muscular dystrophy. So this will be the usual gait or the posture of a patient with muscular dystrophy. So muscular dystrophy, it is a group of diseases that cause progressive weakness and loss of muscle mass. Okay, so in muscular dystrophy, the abnormal genes mutation, that is mutations will happen that interfere with the production of proteins which are needed to form the healthy muscles. Okay, and the particular gait what we can see in muscular dystrophy patient is the waddling gait. So I am not explaining much about these gaits and all. These are some key points that you have to remember and you have to refer further for better performance. Okay, so this is muscular dystrophy, waddling gait that you can see. Okay, now next option what I have given was regarding the cerebral palsy. So you know that cerebral palsy, it is a group of disorders that affect a person's ability to move and maintain balance and posture. So CP is the most common motor disability in childhood. So which is the most common motor disability in childhood, that is cerebral palsy. So in cerebral palsy, the children tend to show a specific pattern of deformity which is known as the postural deformity or positional deformity. So this is the key term of the posture of the patient with cerebral palsy, that is a postural deformity or positional deformity. Okay, so there are some gaits that can be seen in cerebral palsy patients, and the common gait deviations that can be seen are grouped into great patterns of spastic hemiplegia, like foot drop foot will be there, equinus with the different knee positions will be there, and another classification is the spastic plegia. Okay, so the spastic diplegia will be there, like true equinus, jump, apparent equinus, and crouch. This is to facilitate the communication. Okay, so these are the things that you can refer in detail later. So these are some points that I am giving to you to refer further. Okay, so that's all regarding that question. So in that question we are learning about the 4 conditions and the different contractures or postures or the gaits that we can see in those conditions. Okay, now the next question is regarding a picture based question, and in the screen now you can see a picture. So what is this picture? So the question is different. So I have given some numbers 1, 2, 3 and 4. So these are the pictures that you can see in the vaccines. Okay, so these are known as the vaccine vial monitors. So your question is, among these VVMs which can be used? So in the vaccines you can see these stickers. Okay, these monitors can be seen. So in this, which can be used or which should not be used, or which vaccine should be discarded? So that is a question. So here the question is which can be used. So the options are option number A 3 and 4, that means 3 and 4. Then option number B 1 and 4. Then option number C 1 and 2. Then option number D 2 and 4. So if the vaccine vial monitor color shows us like this, which can be used further? So that is the question for you. So the answer for this question is option number C, that is 1 and 2. So vaccine vial monitor, already I have explained what is a vaccine vial monitors. These are small indicators that adhere to the vaccine vials and change color as the vaccine is exposed to cumulative heat, which will identify the health workers know whether the vaccine are exceeded a preset limit beyond which the vaccine should not be used. Okay, so you have heard about the cold chain process and all. So to identify, the health workers will be able to identify whether that vaccines can be used or not with the help of monitoring these vaccine vial monitors which are attached or adhered in the vaccine vials. Okay, so according to the WHO, so this is a from the WHO side we have got this information, like, see, the inner square is lighter than the outer circle. So we have an outer circle and an inner square. So if the inner square is lighter than the outer circle, means that this can be used. If the expiry date is there, means then definitely we can use this. This is a stage 1. Then stage 2 is as the time passes, or if the vaccine is kept outside of a cold box, the inner square is still lighter than the outer circle. Okay, so if the expiry date is not passed, then this also can be used for vaccination. That is the stage 2. Then comes the stage 3. This is the discard point. Now you can see that the color of the inner square matches with the color of the outer circle. Okay, so there is no demarcation. Both are same, both colors are same. Then this is the discard point. So question can be asked like in which stage the vaccine is in the discard point. So this is in the stage 3 where both colors matches. So in this time we should not use the vaccine. And the fourth one is the beyond the discard point, like there will be the inner square is darker than the outer circle. So in this stage also we should not use the vaccine. So this is information from the WHO. So I think these all things we have to see when we are working with the immunization clinics and all. Okay, and in exam point of view also it is very important. So I think that is you got the point regarding that question. Now we will move on to the 12th question in our series. So nightmares occur in which of the following stages of sleep? So it's a regular question that we can expect in the examinations. So the options are option number A REM, option number B NREM 1, option number C 2 N2, then option number D 3 and 4. So what is the answer? Nightmares. So don't be confused between nightmare and night terror. Night terror is different, nightmare is different. That difference you can refer later. Okay. So nightmares are common in option number A, that is in the REM stage of sleep. Okay. So what is REM? So the sleep is divided broadly into two types, like non-rapid eye movement or the NREM, or non-REM sleep, and a rapid eye movement sleep, that is a REM sleep. Okay, so in REM sleep, also known as the paradoxical sleep, which represents only a smaller portion of the total sleep time, and it is the main occasion for dreams or nightmares, and is associated with desynchronized and fast brain waves, eye movements, loss of muscle tone, and suspension of homeostasis. So these all things are happening in the REM sleep, which is also known as the paradoxical sleep. Okay, so REM sleep we can see nightmares, but night terrors can be seen in the NREM sleep. Okay, so regarding the night terrors you can refer it later. Okay, then this again this NREM sleep is divided into further stages like by the American Academy of Sleep Medicine, like N1, N2, N3, and latest it is also divided into a last stage known as the delta sleep or the slow wave sleep. Okay, so this is an additional information for you. Now we will move on to the 13th question in our series. So question is, cellulitis is most often caused by dash. So you have to identify the organism which can most often cause cellulitis. Options are option number A beta hemolytic streptococci, option number B E. coli, option number C Pseudomonas aeruginosa, and option number D bacteroides. So cellulitis. One clue I can give, like from a normal flora only the cellulitis can happen for unhealthy individuals. So the options for this, the answer for this question is option number A, that is the beta hemolytic streptococci. So we know that cellulitis is usually but not always caused by bacteria that enter and infect the tissue through breaks in the skin. So in that group, A streptococcus and staphylococcus are the most common causes of infection and may be found on the skin as normal flora in healthy individuals. Okay, so in healthy individuals these organisms can be seen as the normal flora, but when there is a break in the skin integrity or there is a break in the immunity, so these can act as the pathogens and can cause the cellulitis. Okay, so beta group A streptococcus and staphylococcus are the most common causes of infection, that means cellulitis. Okay, now we will see the second last question in our series, and the question is from the forensic medicine. The question is, brain is stored in which preservative for autopsy study? So you have to identify the preservative which can be used to store brain. So the first one is option number A normal saline, option number B EDTA, option number C glutaraldehyde, and option number D formalin. Easy question. So the answer for this question is option number D, that is formalin. Okay, so we know that formalin fixed, paraffin embedded. So this is a term that you have to remember, FFPE, formalin fixed, paraffin embedded. Human brain tissues are very often stored in formalin for long time. So formalin fixation reduces the immunostaining and the DNA RNA extraction from FFPE brain tissues becomes suboptimal. Okay, so just for your information, this explanation. So with that, we will move on to the last question in our series. So this question is very important, and the question is, which drug is given to prevent HIV transmission from mother to child? So HIV transmission from mother to child, that is the vertical transmission, can be prevented with the help of which antiretroviral drug? So the options are option number A, nevirapine, option number B, lamivudine, option number C, stavudine, and option number B, abacavir. So which is the drug used to prevent vertical transmission? Answer is option number A, nevirapine. So what is nevirapine? So the use of antiretroviral therapy during the late pregnancy, intrapartum and immediately postpartum, it prevents a high proportion of vertical transmission. Okay, vertical transmission means from mother to child, okay, through placenta. So nevirapine administered as a single dose each to the mother and child within 72 hours after birth is used to prevent the vertical transmission of HIV under the prevention of parent to child transmission of HIV program. Okay, so that is PPTCT. Okay, prevention of parent to child transmission of HIV program. Okay, so 72 hours after birth, single dose to mother and kid. Then what is other ARTs that we will see? That is a lamivudine. It is used to treat a hepatitis B infection also. Okay, lamivudine is in a class of medications called nucleoside reverse transcriptase inhibitor, NRTIs, and it works by decreasing the amount of HIV and hepatitis B in the blood, and it can be also used for the needle stick injury. Okay, so immediate PEP, that post exposure prophylaxis, we can use lamivudine. Okay, so then what is a stavudine? Along with the lamivudine, we can use even stavudine also, then zidovudine also can be used for the, as in the PEP, that is a post exposure prophylaxis. So stavudine, it is generally recommended for use with other antiretrovirals, and it may be used for the prevention after a needle stick injury. Again, this also can be used, or other potential exposures. And however, it is not a first line treatment. Then comes the abacavir. Abacavir, it is used together with other HIV medications, and it is not recommended by itself. That means it is not a first line treatment for HIV AIDS. Okay, so with that informative question, we are coming to the end of the another very useful session. So in this session also we have explained 15 questions and have a detailed explanation regarding these questions, and I hope you like the video, and we will be coming shortly with another set of questions very shortly. So till that time, keep stay in touch with us, and I request everyone who are watching this video to share about this platform to your nursing friends and kindly make use of it. So see you on another video very shortly. Till that time, bye.